You've decided to participate in a clinical trial. Congratulations on taking this important step for your health and for advancing medical research. But now you might be wondering, what exactly happens during a trial visit? Today, we'll walk through a typical clinical trial visit from start to finish, so you'll know exactly what to expect and feel confident on your visit day. A successful trial visit starts at home. Good preparation makes everything run smoother and helps you get the most from your time with the research team. Bring your participant ID card, study calendar, and any questionnaires or diaries you've completed since your last visit. Every prescription drug, over the counter medication, vitamin, and supplement you take, even if they seem unrelated to the study, photo ID, insurance cards, and any referral letters from your doctor. Write down any concerns or questions that have come up since your last visit. No question is too small. Many studies have specific requirements before your visit: taking study medication at certain times, fasting before blood tests, avoiding certain foods or activities, completing at-home questionnaires. Follow these instructions carefully. They ensure accurate test results and your safety during procedures. When you arrive, you'll typically find a dedicated area for clinical trial participants, separate from regular hospital or clinic patients. Research facilities are designed to feel welcoming and professional. The staff specialize in clinical trials and understand the unique aspects of research participation. The reception staff will verify your appointment, update your contact information, and let your research team know you've arrived. You may have a brief wait, but research teams typically run on schedule since study procedures require precise timing. Your research coordinator is your primary contact throughout the study. They'll guide you through most of your visit and address your questions and concerns. Your coordinator will ask about how you've been feeling since your last visit, any symptoms or side effects you've experienced, how you've been taking your study medication, any changes in your other medications or health. This is the time to be completely honest. Share any missed doses, side effects, or concerns. The team can only help if they know what's really happening. They'll document any visits to other doctors, new medications or treatments, changes in your health status, any medical procedures you've had. Even changes that seem unrelated to the study are important for your safety and the study's accuracy. Most trial visits include basic health assessments to monitor your well-being throughout the study. Your blood pressure, measured while you're sitting quietly, this helps monitor your cardiovascular health during the study. Your temperature and pulse, quick checks to ensure you're not fighting an infection and your heart rate is normal. Your weight. Many studies track weight changes, as some treatments can affect appetite or metabolism. These measurements help researchers track your overall health during the study, detect any changes that might be treatment-related, ensure your safety throughout your participation. Blood tests are common in clinical trials, providing crucial information about how the study treatment affects your body. Depending on your study, blood tests might check liver and kidney function, blood cell counts, blood sugar levels, levels of study medication in your system. The process is similar to routine blood work at your doctor's office, usually quick and minimally uncomfortable. Drink plenty of water before your visit to make blood draws easier. Let the staff know if you have difficult veins, feel faint during blood draws, or have specific concerns. Look away, chat with the staff, or use breathing techniques to stay relaxed. Beyond basic health checks, your visit will include procedures specific to your particular study, like electrocardiogram, ECG. This painless test records your heart's electrical activity, common in studies of treatments that might affect the heart. Questionnaires. You might complete surveys about your symptoms, quality of life, mood, or daily activities. Physical assessments. Some studies include walking tests, balance assessments, or measurements of strength and coordination. Your study might also include imaging tests, X-rays, ultrasounds, CT scans, specialized blood tests for biomarkers, cognitive or memory assessments, disease-specific measurements. The research team will explain each procedure before starting and answer any questions you have. If your study involves medication, an important part of your visit focuses on your study drug experience and getting your next supply. The team will count any remaining medication from your previous supply, ask about missed doses or timing issues, discuss any challenges you've had taking the medication. This isn't about judging you. It's about understanding how to help you succeed in the study and stay safe. You'll receive your medication supply for the next study period, typically in specially designed packaging with clear dosing instructions, storage requirements, expiration dates, emergency contact information. The research pharmacist will review proper storage, handling, and what to do if you miss a dose. If your team will ask about any side effects you've experienced, discuss what to watch for going forward, review when to contact them with concerns, adjust your monitoring plan if needed. Depending on your study schedule and any specific concerns, you may meet with the principal investigator, the doctor leading the research. The principal investigator will review your overall progress in the study, discuss any significant test results or findings, address medical concerns related to the study, answer questions about the research itself. This is an excellent opportunity to ask about how the study is progressing overall, your role in advancing medical knowledge, any preliminary findings when appropriate. If you're experiencing health issues, the principal investigator can provide medical guidance within the study context, coordinate with your regular doctors, refer you to specialists if needed, make decisions about continuing in the study. Before leaving, you'll plan your next visit and receive instructions for the coming weeks. The scheduling team will work around your availability when possible, ensure visits occur within required study timeframes, provide multiple contact methods for rescheduling if needed. You'll receive appointment confirmations and reminders as your next visit approaches. Before leaving, make sure you have clear instructions for taking study medication, contact information for urgent questions, any special instructions for the period between visits, supplies for completing at-home assessments. Always have 24/7 contact information for the research team in case urgent questions arise. As you leave, you should feel informed about your study participation and confident about the next steps. Your appointment information for your next visit, your study medication and supplies, any updated contact information, the answers to your questions, and any educational materials provided. Many research teams will call to check how you're doing after the visit, follow up on any test results that weren't available during your visit, answer additional questions that arise, provide support between visits. Between visits, take your study medication as directed, complete any required assessments or diaries, contact the team with questions or concerns, follow any lifestyle recommendations. Here are key strategies to make your trial visits productive and comfortable. Before your visit, gather all required materials the night before. Review any pre-visit instructions carefully. Write down questions as they occur to you. Plan to arrive 10 to 15 minutes early. During your visit, ask questions about anything you don't understand. Be honest about your experience with the study. Take notes or ask if you can record important information. Speak up if you're uncomfortable with any procedure. Communication tips. Share both positive and negative experiences. Describe symptoms in your own words. Ask for clarification if medical terms are confusing. Don't hesitate to ask for a break if you need one. It's important to manage expectations. Trial visits often take longer than regular doctor appointments. Some test results may not be available immediately. It's normal to feel tired after comprehensive assessments. The research team's primary concern is your safety and well-being. Participating in a clinical trial is an important decision, and knowing what to expect during your visits helps you feel prepared and confident throughout your research journey. Remember, the research team is specially trained to work with study participants. They understand that clinical trial participation can feel overwhelming, and they're there to support you every step of the way. Your participation in clinical research is valuable not just for your own health, but for advancing medical knowledge that could help countless others. By being prepared for your visits and communicating openly with your research team, you're making the most of this important opportunity. Clinical trial visits are designed to keep you safe, monitor your health, and gather the data needed to develop better treatments. When you know what to expect, you can focus on what matters most, your health and your contribution to medical progress.